back and review the images and so on. So we're still going to be using images, so please be mindful about who you are opening. Actually, hang on here. Sorry, 1 minute. Can't fix this. Yep, so make sure you're being mindful about who can see the slides, who can, visualize your screen, and make sure that you are being respectful of our use of these cadavers and their resources. Okay, really important. All right, so I'm sharing here again. Okay, that looks much better. Okay. All right, so we're getting into the head, part 2, and then continuing on to the neck and thorax. And so I'm going to start by reviewing the sessions, and then we're going to get into some cadaver images. Feel free to drop questions in the chat if you have any from your preparation, or if anything is unclear as we go along. Okay. So just kind of reviewing here, we started off with the head, looking at the salivary glands, so these paired structures that produce saliva in the oral cavity. So they're found in and around the oral cavity, really all three associated with the mandible, okay? So we've got the larger parotid, we've got the submandibular, sublingual. We also have the parotid duct as well. Moving more into the oral cavity itself, we talked about the type of teeth, right? So the 2 incisors, 1 canine, 2 premolars, and then 3 molars toward the back. Okay, so make sure you know what type of teeth, what number, right? So if it's the first molar, second molar, if it's the central incisor, lateral incisor, so be able to describe the teeth relative to each other. We then talk about the frenula, these structures that anchor, stabilize the mouth as we chew, eat, speak, swallow. So we've got the lingual frenula, or the frenula of the tongue, and then the superior and inferior frenulum attaching the lips. We then spoke about the tongue muscles. So 2 major muscles making up the tongue, larger genioglossus, smaller geniohyoid, okay? And this is where we kind of introduced one of the critical stabilizing structures for some of the pharynx and larynx muscles, which is the hyoid bone. So thinking way back to our AMP1, we talked about this as a part of the bony framework of the body, but we also mentioned that it is not touching or articulating with any other bone. And so we're going to encounter some of the muscles that actually help keep that in place. Then getting, again, here into the oral cavity, we talked about the hard palate separating the nasal and oral cavities, and then the tonsils, so the tonsillar groups. Now, these are not readily seen on the cadavers just because they're so easy to confuse with fat and some of the other, connective tissue in the regions, but we will point these out on some models later on. Okay, so the tonsils. And please don't confuse tonsils with the salivary glands, right? Both paired structures, but in different parts of the oral cavity, and they have completely different functions. Then getting into the neck here, so talked about the divisions of the neck, nasopharynx versus oropharynx versus laryngopharynx or hypopharynx, and then some of the important structures here. Again, we'll point some of these out on the body, but then more so on some of our models. Okay, the hyoid bone here once again, and then the 2 important cartilages that anchor some of the strap muscles, the infrahyoid muscles that we also spoke about this week. All right, so these are the muscles, the infrahyoid muscles. Now there are muscles above the hyoid bone. These are not on our list, so we're going to kind of ignore these muscles. The infrahyoid muscles, the ones below the hyoid, are the strap muscles that we will be encountering, and we'll point these out on the cadaver. So again, these are really small muscles, kind of like those extraocular muscles. So get comfortable discerning them from each other, right? Find landmarks, which we'll talk about doing so on the cadaver, where, all of the muscles kind of look the very same if you're not very comfortable. Okay. Then we spoke about some of the vascular structures, so the internal jugular and the common carotid artery, so really the neck vessels, and I'll point these out on the cadavers. Oops. And then we got into the thoracic wall. So what are the muscles and structures we can see if we kind of remove the anterior thoracic wall? So the transversus thoracis is kind of a small muscle on the posterior aspect here. Talked about the diaphragm as well, that main muscle for respiration. And then as far as the thoracic wall muscle itself, it is really divided into 3 layers. So the external intercostal, internal, and then the innermost. Internal and innermost are not easily seen on the cadavers, but I will point out the external, and you can expect to see that on your quiz as well. Okay, So make sure you're comfortable discerning that external muscle. Then we got into the intercostal vessels. So these are the vessels that kind of run in between each of our ribs here, and really important to figure out the order of these of these vessels. So the vein, the artery, and the nerve, and this is a little harder to discern on the cadaver, but I'll point them out so you can kind of get comfortable with doing that. And then some of the other vessels here, the azygous vein and its tributaries, so the hemiazygous and the accessory azygous here. So again, I'll point these out, but remember, this is not a paired structure. The azygous is only found on the right, okay? Whereas the hemiazygous is a tributary to the azygous, and it crosses coming from the left. And again, I'll point this out a little bit better as we go. And then the final set of structures having to do with the lungs. So the surfaces of the lung, the costal surface coming in contact with the ribs, the diaphragmatic surface coming in contact with the diaphragm, and then the mediastinal or medial or hilar surface coming in contact with the hilum of the lung, the central portion where those vessels and bronchial structures are entering, okay? And then the pleura. So the pleura is this double-walled membrane. So we describe that double-walled membrane and the fact that we have the visceral pleura tightly adhered to the lung itself, the parietal pleura tightly adhered to the thoracic wall, and then there's sort of that space, that negative space that is in between those two layers of that pleura. And then very last set of structures here are the actual lobes of the lung and then the fissures that form those lobes. So remember, on the right side is the only side that we see the medial lobe and the horizontal fissure, right? There's no horizontal fissure on the left. There's no medial lobe on the left, okay? So that's kind of what we went through this week. So we're going to spend some time here looking at some details on our cadaver images. Now I have a lot of images, and so I want you to get a lot of different views, different exposure to these structures. And so I'm not going to spend too much time on each, but please feel free to stop me if you need clarity or anything like that. Okay. And again, if you have any questions, you can go ahead and drop them in the chat at this point. But let me go ahead and get started. So we're starting off here with a mid-sagittal view of the skull. This is a left view or a left section. And so things we can appreciate here are the hard palate. Actually, So we can appreciate the hard palate here, right? So this is hard palate. And you remember the structures, or we should remember the structures that formed hard palate, the palatine bones posteriorly, and the palatine process of the maxilla anteriorly. We've also got the soft palate, which is the distal projection, more made of connective tissue. We can appreciate that the bony structure kind of ends here, and the rest of this is soft kind of connective tissue extension. And then this is going to end in the distal tip called the uvula. Okay, so here's that uvula. We should be able to appreciate the opening to the pharyngotympanic tube. So here's the eustachian tube opening. And then here is where those adenoid tonsils would be. Okay. We've also got a nice view of the left side of the oral cavity. And so we can appreciate where the frenula would be. So we appreciate the superior frenula, the inferior frenula down here, right? Anchoring the lip to the gum. And then we can see the left part of the teeth here. Okay. Here's another view, so a right section or a view of the right side. And I've retracted the tongue. Actually, let's go back here. We can also appreciate the tongue. So this large muscle, the bulkier of the two on top is the genioglossus muscle that forms the tongue. On the next section here, I've retracted the tongue with my finger, and so we can really get an appreciation of those frenula. So the lingual frenula, that attachment here, again, superior frenula, inferior frenula, and then we can see the right side of the teeth here, and I'm retracting the genioglossus muscle. Also appreciate the pharyngotympanic opening here again, and then this is where the adenoid tonsils are, the adenoids or the pharyngeal tonsils, excuse me. And then we can also see the hard palate and uvula as well, okay? And then we can see on both sides here, same set of structures. So I'm just gonna kind of go over this quickly. The hard palate, soft palate, more clearly the uvula, right, on this side as well, hard palate, the extension, soft palate, uvula. We can see more of the genioglossus muscle, so this large fan-shaped muscle, and then the geniohyoid muscle, which is the smaller of the two tongue muscles, okay? So again, that large genioglossus, and then the smaller geniohyoid. We can also appreciate the epiglottis. So here's the epiglottis, that flap that would cover the laryngeal inlet. Okay, so here's vertebral column, here's the opening to the laryngeal inlet, essentially the larynx, and then here's the epiglottis, that flap that would cover that. And here's the epiglottis on the right, okay? So make sure you're also keeping that laterality in mind and, you know, finding ways to discern left from right as you practice this. So here's an inferior lateral view of the neck, and we can appreciate some of these salivary glands a lot clearer here. So the submandibular gland, lateral and inferior to the mandible, it's kind of been pulled out here so you can really see it. The parotid gland, much larger of the three, and then the parotid duct kind of entering the oral cavity here, right? Remember this muscle from last week, the masseter, and then the buccinator, which is deeper here. We can also appreciate some of the neck structures here. So the hyoid bone as a landmark, the trachea descending here in the neck. And then we're going to talk about some better views of these muscles, the infrahyoid muscles, a bit later. Now, this is where these sublingual tonsils, the sublingual salivary glands would be, right underneath the mandible, in between the bellies of the digastric muscle here. Right, so adding some more clarity here, submandibular salivary gland. Parotid is not so clear from this view, but then sublingual glands deep underneath the mandible here. Here's a much better view of the parotid once again, so the large gland here, and then the parotid duct as well, entering the oral cavity. And then you can also see the submandibular gland here also. Better view of the submandibular gland, here we go. Hyoid bone, again, as a landmark, trachea descending into the neck here. And then we can see the parotid gland, parotid duct, excuse me. And here I'm actually pulling the parotid duct out so you can get a better view of that. And then off to the side here are the parotid glands. Okay, so let's get down into the neck now, and we'll start with this first. This is a superior view. And so this cadaver has been decapitated. So you're not going to see the head at all, but we want to appreciate the neck structures that are visible from this view. So we've got the trachea here, centrally located. Here's the thyroid gland, right? So the superior poles of the thyroid gland. This is the entire thyroid gland here, left and right. And then here is the thyroid cartilage. So here's the superior aspect of the thyroid cartilage, where we've actually decapitated the neck at. And then so here would be the hyoid bone. It's not very visible because of the connective tissue, but this is where the hyoid bone, the hyoid bone is higher, actually, forgive me here. This is where that cricoid cartilage would be inferior to the thyroid cartilage, okay? Some of the other venous structures we can see, so we've got the jugular vein here, and then the carotid, common carotid here, again, carotid on this side, and then can't really see the jugular on that side. Okay, so here's a more superior view of that decapitated neck. So here's the vertebral column that's been cut posteriorly. Here's the opening into the trachea. Anteriorly, here's that thyroid cartilage, so that cartilaginous connection there, that thyroid cartilage. And so we can see that more from a superior view. Here's the cut surface of the carotids, once again. And you should be comfortable figuring out a vein from an artery at this point. So you can see that nice stiff wall, which really indicates this is an artery as compared to that thinner wall, such as this, which is a venous structure. This is a venous structure as well, that thinner wall, whereas this is a much more turgid or patent artery there. Okay. Now this is quite a messy picture, but I do want you to get comfortable looking at images like this, right? And start being able to differentiate structures. So, right, these are some of the muscles. Again, I'll point out these muscles a bit later on, but these are some of those infrahyoid muscles. So here's that omohyoid. Here's that sternocleidomastoid. And I'll point these out a little bit later on a clearer image. But I want you to begin getting comfortable figuring out what's muscle, what's cartilage, what's a vessel. These are some of those strap muscles here. So sternocleidomastoid, okay? Here is the carotid artery. So again, being able to differentiate this as a turgid, patent structure, and differentiating that from some of the muscles and veins in the region. We've also got the submandibular gland here on the left, okay? And then we can see parts of the lungs. So here are the lungs in the thoracic cavity here. So we've got left and right lungs, and then we've got the heart here. And then these are some of the major vessels that are leaving the heart. So the superior vena cava on this side. Here's the arch of aorta. And again, we'll talk more about this next week when we look at the heart itself and some of those major vessels. Okay, so now let's get into those neck muscles, those infrahyoid muscles here. So this is the sternocleidomastoid that's been retracted. And remember, sternocleidomastoid has 3 attaching points. It's coming from the mastoid process in the temporal bone, the sternum, specifically the manubrium of the sternum, as well as the clavicle, hence the term sternocleidomastoid, okay? So I've retracted that here. And I also want you to appreciate that we've cut the clavicle. So this is the cut surface of the clavicle. And so we're not going to see where that muscle would actually attach to the sternum, but we still want to appreciate, you know, what that muscle is, although it's not attaching to that bone. Deeper here, these are some of the other strap muscles. So here's the omohyoid. And omohyoid is going to curve backwards, okay? Really important to differentiate that one. And the prefix omo actually means shoulder. So the omohyoid is going to go back and attach to the scapula. And so that is going to be that 2-bellied muscle that goes from the hyoid bone all the way back to the shoulder. More centrally located are 3 other muscles, and it's really important to figure out the landmarks as far as discerning these muscles from each other. So here we have the hyoid bone. Here we have the thyroid cartilage. So here's the thyroid. All of this is thyroid cartilage. And then down here is where the manubrium of the sternum would be, okay? And so from those 3 landmarks, you should be able to figure out, or, you know, by the name of the muscles, the attaching and origin points of the following 3 muscles. So the first one is the sternohyoid muscle. So the sternohyoid muscle is this guy right here. It goes all the way from the hyoid bone down to where the manubrium would be, okay? And again, think about the name of that muscle to really help guide you. So sternohyoid muscle. The deeper muscle is going to be the thyrohyoid muscle, right? So that is going to go from the thyroid cartilage, which you said ends here, up to the hyoid bone. Okay, and it's getting a little messy at this point, but this is that thyrohyoid muscle. It's right on the thyroid cartilage, okay? And then a little bit inferior, we're gonna have the sternothyroid muscle. So the sternothyroid does not go all the way up to the hyoid bone the way that sternohyoid does, but it only goes up to the thyroid cartilage, okay? So I really wanted to spend some minutes here really allowing you to figure out the landmarks and how you can appreciate these muscles from each other. And then we're going to go through some examples. Okay, so a much better view. So again, we've got the sterno, where this is attaching, hyoid muscle here, sternohyoid, right, on both sides. We've also got the omohyoid, again, going from the hyoid, but going backward towards the scapula here. And then here's omohyoid going back on this side. And then we can see the lateral aspects of the sternocleidomastoid here, sternocleidomastoid. Okay, let's look at another. Here I'm actually retracting sternohyoid. So remember, sternohyoid covers all of the muscles. It comes from the sternum all the way up to the hyoid bone, and I'm retracting it here with my fingers so we can get a better view of the deeper muscles. So this one is sternothyroid. So sternothyroid only goes up to the thyroid cartilage. So that's sternothyroid on the right and sternothyroid on the left. And then we can also appreciate thyrohyoid, which is right on top of the thyroid cartilage, right? So thyrohyoid on the right and thyrohyoid on the left. Here is omohyoid, again, the one that curves backward towards the scapula on the right, and here it goes on the left. And then last but not least, the larger sternocleidomastoid forming the lateral borders here. Okay. Now in this view, I've retracted sternocleidomastoid once again. So sternocleidomastoid, and I'm repeating this so you can get a lot of exposure and practice with this. And so I'm going to go over this one more time. So sternocleidomastoid being retracted here, okay. Sternohyoid also being retracted. So I'm kind of flipping sternohyoid, that longer one that covers all of them. And then we can see omohyoid much clearer, omohyoid. We can see sternothyroid going up to the thyroid cartilage, sternothyroid. And then last but not least, the shortest of all the muscles, that thyrohyoid, which is right on top of the thyroid cartilage, okay? Here's the laryngeal prominence, which is also one of our structures this week, and that is gonna be that prominent bony projection on the thyroid cartilage. We can also see the cricoid cartilage here and the thyroid gland inferiorly as well, okay? Some other structures in the view here, the arch of the aorta here. And so here goes that carotid coming up, ascending into the neck as well on the left. Okay, just another view of those muscles. So again, get comfortable here, thyrohyoid, omohyoid, sternothyroid, SCM, sternocleidomastoid, and then I'm retracting sternohyoid, okay? All right, let's get into the posterior abdominal wall structure. So these are kind of the final structures here, talking about some of the nerves in the region. So we can appreciate the jugular vein here again, and then the carotid artery more medial. So carotid artery, and then the jugular vein is really distorted on the right side, but we can really appreciate it here on the left. Once again, the arch of aorta, and then the posterior abdominal wall on both sides. So we can see that the lungs have been removed. So I pulled out the left lung here, the right lung here, and we can really see the posterior thoracic or posterior rib cage or that wall there. In the center here is the heart. So we're going to kind of completely ignore the heart for this week, but we'll talk about the heart structures next week. And then the inferior surface of the thoracic cavity is formed by the diaphragm. So the diaphragm is this large dome-shaped muscle that can be seen forming the posterior boundary of the thoracic cavity there, okay? And then once again, we can see that truncation where we have the thyroid cartilage, the trachea in the middle here as well. So just a closer view of some of those structures. An even closer view here, we can really see the heart. And we can also appreciate the nerve. So here's that phrenic nerve. Remember, the phrenic nerve is running off laterally. It's going to run right around the lateral aspect of the heart and the pericardial sac that covers the heart. So you can see it attaching to that sac here. And if I go back here, you can see it on the right as well. So here's that phrenic nerve, on the left, phrenic nerve on the left, phrenic nerve on the right, and it's going to run around the lateral aspects of the pericardial sac around the heart. Now, we really want to differentiate the phrenic nerve from the vagus nerve. So here's the vagus nerve. Vagus nerve is going to wrap around the arch of aorta on the left, and is going to wrap around the subclavian here on the right, okay? So here's that vagus nerve. It's much more medial in the thoracic cavity, whereas phrenic is much more lateral, coming into contact with that pericardial sac, okay? So let's keep going here. So once again, we can really get a clear difference of that phrenic coming out laterally and that vagus wrapping around the arch of aorta medially, and then continuing down to innervate the gut and so on as well. Closer view of the left posterior abdominal wall, thoracic wall, left posterior thoracic wall here. And we can really appreciate the intercostal vessels, okay? Now remember, the order of these structure is gonna be vein, artery, and then nerve. The nerve is usually the more patent, more obvious of the structures to see because it's kind of contrasting color from the artery and vein. And so we can slightly appreciate that as well here. A little bit of a better view here, intercostal nerve, intercostal artery, intercostal vein. Okay, the vein is much darker, the nerve, and then the arteries in between. Okay, we can also see the azygous vein, and the azygous vein is only on the right, right? So this is a part of that azygous vein as it communicates to the superior vena cava. And you really have to kind of move the heart. As you can see me kind of moving or shifting the heart out of the way so we can really see that azygous vein as it ascends on the posterior vertebral column here. So here's where the vertebrae are, and it's going to ascend running alongside the anterior aspect of the vertebral column. Also appreciate the diaphragm here. So here's that diaphragm. And then I'm actually holding in my hand, also attracting the phrenic nerve. So hopefully you can appreciate that. So better view again, phrenic nerve coming down, vagus nerve here, more medial. And then here is a deeper view. This is actually a lateral view or a side view. And I'm really trying to get a good shot of the intercostal vessel so you can really appreciate the difference of those here. So here's that nerve, and then the artery in between, and then the vein, the darker of the three structures. Here's that dome-shaped diaphragm inferiorly. So this way is to the foot, and this way is to the head. Okay, and you can sort of do so, you can sort of, figure that out, discern that by looking for the diaphragm, right? The diaphragm is going to be inferior border of the thoracic cavity, and then you can also appreciate some of the neck structures here as well. Here's the vertebral column that I was pointing out earlier, and here's that azygous vein running up and then dumping into the superior vena cava here. Okay, both of those entering into the right side of the heart. Here's a bit of a clearer view. We can really kind of see the vein, the artery in between, and then the nerve, right? Vein, artery in between, and then the nerve, okay? So kind of get comfortable looking at several of these images and sort of differentiating. So here's another cadaver structure where this is a lot clearer. And just to give you, again, a good understanding of that relationship, we've got the vein, the artery running in between, and then the nerve. The artery is probably the hardest of the three structures to visualize on the cadaver. Here's another view where we can see a lot clearer the jugular veins here, the carotids here, medial to the jugulars, the trachea bifurcating into left and right bronchus. And then here's the abdominal aorta, which is coming off of the arch of aorta. Here is the azygous vein running or ascending and then dumping into the superior vena cava. And then we can see a nice view of the diaphragm here. Okay, and I've just got this schematic or this drawing here to really show the relationship of a zygous. It's a little bit hard to visualize a zygous, but here's a lateral left view or a lateral view of the left side. So we're looking from the right to the left side here. And so we can see the azygous again ascending on the anterior aspect of the vertebral column, curving over the hilum of the lung. So these are the structures that are entering the mediastinal or the hilar surface of the lung, the right lung, and then dumping into that superior vena cava. So really getting an understanding of the relationship of how a zygous communicates into superior vena cava, excuse me. And then here's that inferior vena cava for reference. Another view here of the tributaries of the azygous. So here's a zygous ascending, and then it's going to curve over the hilum of the lung and dump into superior vena cava. And here are the tributaries that are draining into the azygous, really the intercostal veins. So all of these veins kind of congregate and they drain into the azygos on the right, but the hemiazygos, which only goes halfway up, on the left. So hemiazygos is a structure that's found on the left side. It only drains about half the way up, and then it crosses and dumps into the azygos, okay? The accessory azygos drains the top part of the intercostals, again, crosses and dumps into the azygos on the right. So there's no azygos on the left. On the left, the structure is called the hemiazygos, and then the accessory azygos as well, okay? Last couple of structures here. So getting into the lungs. So this is just an anterior view of where the lungs are, still intact in the thoracic cavity here. So we want to appreciate the horizontal fissure, which is only found on the right lung, and then the medial lobe, which is only found on the right lung, okay? Again, you can see the diaphragm here. Now really get comfortable figuring out which lung you're looking at. That's something that you should be able to discern. So if you just see, or if you get an image of just the lung, you should be able to figure out how it would fit in the body and which lung it is. So can anyone tell me which lung we're looking at here? Just as a way to kind of practice this. Which lung is this shown here? Any ideas, any guesses? So I'm seeing both left and right in the chat, but left is correct, right? So we want to think about the posterior border of the lung, the posterior border of that lung, the base of that lung, the anterior border of that lung, the apex of that lung. And so having those 3 points figured out, this can only fit on the left side, right? And you should be able to kind of do that spatial organization in your mind and see that from this lateral view. Another thing that we can use to sort of guide us here is the fact that we only see the oblique fissure. So there's only one fissure, only 2 lobes, superior lobe, inferior lobe. And again, the left lung is the one that has only 2 lobes, right? 1 fissure, 2 lobes. So here's another view of the left lung. Again, anterior border of that lung, posterior border of that lung, apex, and then the diaphragmatic surface or the base. Here's the hilar or the mediastinal surface. And so again, this will only make sense being on the left side. Okay, can anyone tell me what lung this is? So here's the diaphragmatic surface. Here's the posterior border. Here's the anterior border. Here's the apex. So what lung would this one be? Right, yes, perfect, thank you. So I'm seeing in the chat here, right lung, and that's correct, right? So again, be comfortable figuring out which lung you're looking at just by looking at any surface of that lung, okay? Really important. You don't have to have it, in the body to be able to discern that. Here's another view, a lateral view of the lung. Again, we know this is right lung because of the anterior border here, apex here, posterior border here, base here, but then also we can see the middle lobe as another indicator, and superior lobe, inferior lobe. Here's the horizontal fissure, here's the oblique fissure, okay? So you don't have to have a view of the lateral surface of the lung where you can see how many lobes there are. Even if you have a mediastinal view, you should be comfortable, such as this, discerning which lung you're looking at. So again, anterior border, diaphragmatic surface, posterior border, apex. Okay, so that makes this the right lung. And then you can see some of the hilar structures entering here. So the bronchus, the pulmonary artery, and then the pulmonary veins. Okay, here we get into the posterior thoracic wall, the anterior thoracic wall, a posterior view of that. And there isn't much that we can see here. We can see a part of the diaphragm attaching. And we want to appreciate that the parietal pleura is attached here, okay, really important. The parietal pleura is attached to the anterior surface of the lung, to the anterior surface of the thoracic wall, whereas the visceral pleura, the internal connection of that double lining, is attached to the anterior surface or the costal surface of the lung, okay? So we just want to understand that parietal pleura is attached there. Here's an anterior view. Here's a better view of an anterior thoracic wall. And I want you to kind of figure out or appreciate that this is not the external intercostal. This is actually the pectoralis muscles attached, okay? So we want to think about the pectoralis muscles attached here. And then these are the fibers of the external intercostals, okay? These are the fibers of external intercostals on the lateral aspects of the thoracic wall, okay? And not these fibers. This is going to be the pecs. Here's a posterior view again. We can see the transversus thoracis, the ligamentous attachment of that muscle found on the posterior thoracic wall here. So transversus thoracis, we can see the attachment of the diaphragm here. And then again, we want to understand that the parietal pleura is attached to the thoracic wall, okay? And here's just another view of that, the transversus thoracis muscle attached to the medial aspect of the anterior thoracic wall. And then the diaphragm attached here as well. Okay, so we're gonna get into some models here and now point out some of the other structures that are not visible on the bodies. So here's a laryngeal inlet. Here are the vocal cords or the true vocal folds here. And then we can see the epiglottis as well, that flap that would cover the laryngeal inlet. So that's a superior view. We can also appreciate that this is the hyoid bone on top here, okay? Here's a left lateral view. This is the thyroid cartilage, cricoid cartilage, trachea, hyoid bone, okay? And these are some of the membranes, the ligamentous membranes that help to keep the larynx, the hyoid bone and so on in place. Here's a right view of that. So similar structures, thyroid cartilage, the largest of the two. Cricoid cartilage can't be seen because it's actually underneath the thyroid, this muscle here above the thyroid cartilage. So here's the thyroid gland. Okay, here's the hyoid bone. Internal view of the larynx. So here are the true folds. Here are the false folds. Remember, the false are going to be slightly superior, slightly lateral, whereas the true folds are going to be slightly medial, slightly inferior, okay? Once again, we've got the epiglottis here, that flap that would cover the inlet. So it's going to flap down, cover the inlet, and then food will slide back here, enter what would be the esophagus posteriorly, okay? And then we can see the proximal bits of the trachea as well. Here's just the bronchus showing the right bronchus, left bronchus, and then some of the distal branching structures of the trachea. And then here's that superior part of the trachea as well. Here's another model where we can see the parotid gland, parotid duct, the submandibular salivary gland as well. Here's another view. We can actually see the sternocleidomastoid muscle here as well, the parotid duct, and then slightly the submandibular gland. Now here we can see the tonsils. This is probably the only area that we can see all of the tonsils clearly. So here's that opening to the eustachian tube. This is the nasal cavity. This is oral cavity. This is the adenoids or the pharyngeal tonsils, excuse me. This is the palatine tonsils. And then here would be the lingual tonsils. Remember, the lingual tonsil at the base of the tongue. So we're not going to easily see them on the cadaver, but this is where they are on a model. So lingual, palatine, and then pharyngeal. This is nasopharynx, this is oropharynx, and then here's going to be laryngopharynx or hypopharynx. We can also see the epiglottis, and then the true folds and false folds, okay? Another view showing similar structures, soft palate, we can also see here, hard palate. This is where we've got the adenoids, the opening to the eustachian tube, nasal cavity, nasopharynx, oropharynx. Here are the the lingual tonsils at the base of the tongue. Here's that large genioglossus muscle, geniohyoid muscle, epiglottis here, and then true folds, false folds, and then the trachea at the bottom.